Apologies.
Good day and welcome, everybody. This week we are celebrating a campaign of awareness, trying to break the stigma and provide education about the chronic illness of bipolar disorder. It's an extreme privilege for myself, representing SADAG, to introduce our guest today. And this morning we're going to be having a conversation around bipolar disorder. Now that you've been diagnosed, what next? So, what better to hear from the expert, Dr. Hussein? And by introduction, I would just like to share with you his background and his academic journey as a psychiatrist to where he is now. Dr. Hussein completed his undergrad at the University of Cape Town. He then took specialist training in psychiatry in the United Kingdom. Thereafter, he worked as a consultant psychiatrist in the NH service in the UK. So you've certainly been overseas and exposed to substantial experiences in the greater world. Dr. Hussein is a member of the World College of Psychiatrists. He also holds a postgraduate diploma in cognitive behavior therapy and occupational medicine from the United Kingdom. Dr. Hussein works part-time at Lentgeel Psychiatric Hospital and is a senior lecturer at the Department of Psychiatry at the University of Cape Town and has a private practice. So a very busy gentleman. Dr. Hussein, thank you so much for joining us today. It's an absolute privilege to speak to you, but more importantly, it's so important for us to get the message out there and educate not only SADAG counselors, but the greater population of that there is a possibility, there is hope in how to live with bipolar. Welcome and thank you for joining us.
Thank you so much. It's a great pleasure to be part of your show, and SADAG's a fantastic organization. So I'm very privileged to have been invited to come and participate and share my experience with you guys.
Fantastic. So let's get the show on the road. Let's get started. For many people, receiving a diagnosis of bipolar disorder can be incredibly overwhelming. So, what are the first steps that somebody should take when they have been diagnosed with bipolar disorder?
Yeah, I think it's most important just to first acknowledge that, when you get that diagnosis, it sometimes can come as a bit of a shock, a surprise. So there's all of those normal emotions that, people would feel, the sense of, confusion, sense of anxiety, being afraid of the future. And what's important is to emphasize those are normal reactions. It's okay to feel like that. uh, Um, and also remember that a diagnosis, and I think it's very important, is not the end of the road. I think people sort of initially get diagnosed, and, oh my God, what's my life going to be like? It's not the end of the road. In fact,
Mm,
getting the correct diagnosis is actually just the first step on your journey to recovery. So
yeah.
rather look at it that way, right? And ironically, for some patients, I actually found it's the opposite. There's a sense of relief when they get the diagnosis. Yeah, and
Hmm.
and and the reason is that people have been struggling with their mood, they've been struggling with this behavior, their families have been struggling, and they don't actually know what's going on. Even the patient themselves may not actually recognize what's been happening to them. And now you sit down and have a discussion with them and say, this is your diagnosis, this is what it's about. And suddenly, that aha moment, oh, so that's what's been happening. Now it
Mm,
makes sense. So for
mm,
some people, it's not always a negative, it's actually, a welcome, and now everything makes sense to them. It makes sense to their family. Now they can start to move forward. So I think
yeah.
having a correct diagnosis is a good first step.
Mm,
And then from there, I think there's four particular things I want to emphasize after that initial first step.
mm,
First
mm,
is education. So once you know your diagnosis, go and find out more about it. Educate yourself, not only you, your family members as well. So learn about the condition, find out about the symptoms, how does it present, what are the treatment options available. It's also important, when you're looking at a condition like bipolar, to understand that this is a medical condition. Because some people have this notion that, somehow they are to blame. They are flawed in some way. This is a character defect. They're a weak person. So often we have to address some of these stigmatizing views that are out there that are prevalent in the community and say, no, actually, this is an illness. Just like if I was diagnosing something diabetes or hypertension. You've got hypertension, I'm not saying you're a weak person because of hypertension. It is just a
Mm,
medical condition that needs to be treated. So hence the education is really important, and that can often allay a lot of these fears, anxieties, and misperceptions.
mm, mm,
The second step is to access then professional help. So once you've got the diagnosis, and this can be done in various ways. You could start off with your GP. It might be maybe at a clinic. It might be a day hospital setting, depending on where you are. So you might have an initial consultation with a health professional who might then refer you on to maybe a psychologist, a counselor, a psychiatrist, some mental health professional that can do a more in-depth, detailed assessment. Um, and some people struggle sometimes to access care or to access services. So SADC is great because they can often signpost individuals, SADC and other organizations, signpost individuals to where they might be able to access those important services. And,
mm.
and the reason I'm emphasizing this is because early engagement with treatment is very important. Just like any other medical condition, the earlier you catch it, the earlier you can get treatment, the better the outcome. And in the case of bipolar, the earlier we can engage with treatment and get you on the right treatment, we're going to minimize relapses, and that can improve your long-term outcome. So that's why it's very important to engage with the correct services.
Mm,
Third
mm.
step is once you've got your diagnosis, important to build a network of support around you. So this could be friends, it could be family members, maybe some community support groups. And again, I want to emphasize that often in South Africa, I find that, stigma is a big barrier to people accessing the kind of care and help. And sometimes the very people that you think you need to support you are the ones that are stigmatizing. So sometimes you might have to look beyond your family members or beyond, your friend group for other people who might be more understanding and informed to provide you with that support. Um, and even just having one or two individuals, close individuals who understand your condition, can make a significant difference to provide that support. So you don't need vast networks. It can just be one or two individuals.
Mm.
And then I think the last step is starting to understand your condition. And what I mean by that, it's starting to become familiar with your symptoms and your signs, and you start by monitoring your mood and monitoring your behavior. So it'd be a simple thing like keeping a diary, keeping a logbook. So every day you can plot your mood, you can rate it from 0 to 10, or you can just write down in a narrative like, I'm feeling great today, or I'm feeling down today, I'm feeling anxious. So making a note of your mood, making a note of what was your sleeping pattern like. Did I have a good 8 hours sleep? Was it broken sleep? Did I have no sleep at all? Was I sleeping 12 hours a day? And perhaps any stress or any particular significant events in that day that might have triggered you or that might have caused you to have a problem. And the reason this is important is because it starts to create a database for you where you can
Yes.
start with some early insights about, what are the potential triggers?
Mm,
Are there particular exacerbating conditions? Are
mm,
there things like, oh, I forgot to take my medication because I had to do X, Y, and Z. So that, okay, now I start to identify, okay, maybe I need to, modify my lifestyle. I might need to modify my routine to minimize either me forgetting my medication or I'm starting to identify particular stresses that I might need to address. So that's why having this sort of diary and monitoring your mood and behavior starts to help to inform you about simple interventions, but very effective interventions that are very helpful in the long term to minimize
mm,
the negative impact from those external stresses that you might experience.
mm. So you've summed it all up, which is absolutely fantastic. And I think that what really hit home to me is that for so many people who are battling undiagnosed bipolar, so these mood changes, um, deep bouts of depression, then those manic highs, and they don't always come fairly quickly to eventually arrive with a diagnosis is a sense of relief because, as you said in the beginning, once you can name it, you're able to start working with treating it. So I think that's so important, and it's almost part of the message of hope that, if you are uncertain, don't be scared because bipolar disorder is treated. And so, where do we start? And I wanted to look up just as you were ending your last sort of statement, what are those early warning sort of personal triggers? And I know that there is obviously there's the DSM categorizes what are the potential behaviors and how it plays out. But when we look at life nowadays, there's so many stresses, work, relationships, unemployment. And it's really hard to package that together. So, what are some of the key elements, those personal triggers that we should be looking out for, even if we've been diagnosed now with bipolar? Um, what should we be trying to manage a little bit better in life? Because even with the illness, they can still function.
Mm. So I think there's probably two parts to answer your question. I think the first is uh, to look at some of the common stresses that people encounter. Some of
Mm,
them are things that can be managed, and some of them sometimes they're just out of your control. And then we'll sort of touch on some of the early warning signs. So just to get back to the stresses. So they can be big things, like you could have a loss of a loved one, you could lose a
yes,
job. So these could be unexpected events that you don't have any control over.
right.
Then there might be other things that you do have some control over. It might be work stress, maybe some conflict in the family, some relationship issues where maybe you could intervene, or there could be some help provided or some intervention provided. Maybe financial stress, and in South Africa, exposure to trauma is a big thing. So there's
Yeah.
certain things that you can intervene, certain things that you can't. Probably one of the biggest things in South Africa that the individual can definitely do something about is substance misuse. And very often, substance misuse is a trigger and also leads to relapses. And we know we've got very high rates of substance misuse in South Africa. And that is something that, an individual has more control over than maybe, a loss of a loved one, for example. So I often find that that's a big trigger. And then there's a very close relationship between substance misuse and mood disorders.
Mm, mm.
Another important one, and again, it sort of links to early warning signs, is disruption of sleep. So there may be external factors that disrupt your sleep. Maybe the things that you do that disrupt your sleep. So for example, I find this commonly. People, particularly students, they'll be perfectly well controlled all of the year. Then it's December holidays. Then they're going off and partying and having late nights with their friends. And then after a few weeks, they've had a relapse because they've been
Yeah.
sleep deprived. Their normal sleep wake cycle that was sort of managing their symptoms quite nicely has now been disrupted. Uh, and that completely throws them out. So, sleep routine is very important, and sleep disruption
Yeah.
then triggers relapses. So very often you can control certain things like sleep, or like staying awake very late at night because you're on your devices. Another one that maybe is a little bit more tricky, and perhaps we'll touch on later, is shift work. So for some
Okay.
individuals, unfortunately, they have to do shift work.
Yeah.
Some people may not always have a choice about the nature of the job, but shift work can also trigger episodes of bipolar. In fact, it's shift work is actually a contraindication to bipolar, but in our context, we can't tell people you can't work. So
Yes.
then to be aware of that, and sometimes you have very accommodating companies that are able to work with individual, or maybe modify their schedule so that they can be accommodated. Um,
Mm,
but yeah, I mean, shift work is an important thing, and that links to the disruption of sleep. So when we think about early warning signs, there's obviously the two components. We've got the manic symptoms, and then we have sort
yeah.
of depressive symptoms. So reduced sleep is actually one of the early symptoms of mania. And it
Right.
starts with reduced sleep. So before you even perhaps get the high mood or the irritable mood, there's sort of this lead up of a few nights of disrupted sleep or broken sleep or sleeping a lot less. And then the person starting to either sort of be a bit more agitated, a bit more restless. Maybe the energy levels are starting to go up. Not dramatically, but they're starting to notice, or they're starting to sort of chat a lot more, and the family is noticing, but they're sort of yakking a lot more to me. Um, they're starting to sort of almost be a bit overly happy, a bit overly elated for no good reason.
Mm,
They start, maybe becoming a little more impulsive. They're starting to buy more things that perhaps they don't need. They perhaps sort of being a little more disinhibited, so kind of, less filter between the brain and the mouth, sort of saying things that, perhaps they wouldn't normally say. So you start to see this little pattern initially emerging. And that's some of the early warning signs of mania. And then
yeah.
conversely, You can also have early warning signs of depression. And again, sleep is probably one of the early ones, so often
Yeah.
disruption in sleep. And with depression, usually, again, you can have reduced sleep. But about 10% of people actually go the other way, where they actually find that they sleep a lot more. So what we look at is what is your change from your baseline. So for example, if you are maybe an 8 hour sleeper, now you're sleeping 12 hours. That's a significant change from your baseline. And
Mm-mm.
unlike having more energy levels, often people start becoming depressed. They still, becoming more lethargic, more fatigued, complaining that sort of, everything is a bit of an effort. So, so even normal everyday tasks just start to become more of an effort. They start becoming a little more isolated, not wanting to socialize with maybe people, talking a lot less as opposed to talking more when they become manic. Um, Also more negative thoughts. So rather than kind
Yeah.
of being optimistic, when people are on the up, they become more pessimistic, so often negative.
Mm-hmm.
And this kind of sense of hopelessness, kind of just hopelessness, helplessness. So you start to see those kind of symptoms emerging when somebody's sort of starting to go into a depressive episode. And also
Mm.
anxiety can be sometimes a common
Yes.
presentation. It may not always be low mood. Sometimes people forget that anxiety can actually be a precursor. And another common symptom is actually pain. So many people present with pain as early warning signs. So they start having all these
Oh.
aches and pains for no good reason. They go to
Mm.
the doctor and like, I've got an ache here and a pain there. And then later on, this sort of full-blown episode of depression comes. But it starts off so often there's these three things. There's the low mood, which you're often familiar with, but anxiety and pain are maybe two less well understood presentations, but they can be early warning signs.
Right. And I remember, doing so many over the years working in the space of mental illness, is that one of the challenges that we face with early diagnosis for bipolar is that a lot of these early warning signs, behaviors, and mood changes often happen in those early 20s, which is also the party test time of life. Um, it is the normal for teens to sleep a ton more than just 8 hours a day. And mood changes are also significant with hormones and kind of like that exploring the untouchable as well. And I think what I'm picking up here, and I really would like to be able to share and for you to endorse if it's correct, is that when things are not normal for individuals, even with the general accepted norm, if you feel it's not right, you need to reach out to a doctor to assess that there could be a possibility that this could be bipolar. And I think, we also want to keep the calm amongst the parents. Not every child that is going crazy and doing silly things and sleeping too much or not sleeping will be diagnosed with bipolar. So there's a real filter to consider. And I think that's the challenge that we face with bipolar and why so many people shy away from coming forward with early diagnosis.
I think also just on that, I think you mentioned about the early 20s. Um, One of the practical things, especially when somebody's having several episodes, is you can start to identify what we call a relapse signature. And that's why it's also important linking to what I mentioned earlier about keeping the diary, keeping a
Yes.
log. And this is a very practical tool. So
Mm.
each individual has got their own unique set of early symptoms.
Yes.
So even though I
Yes.
sort of listed a few of those that, it may be different for other individuals.
Mm.
And the reason that's important is because once you sort of start to understand your early relapse signature, which is unique for you,
Yes.
then you are informed, but also importantly, your family members can start to identify there's a potential relapse. And
Mm.
sometimes I find that actually the family members can pick up much earlier that something's going on before the patient even identifies there's something
True.
wrong. So,
Yeah.
so that's also important, why it's important to sort of identify these early symptoms. And a key question I tell patients to ask themselves, okay, what changes do I notice before I become unwell? So often this is done in retrospect, but over a period of time, they can start to identify certain patterns, certain symptoms that start to occur very early on. And by
Mm.
you identifying it and by informing your family members, okay, if you notice A, B, C, D happening, then that probably means it's an early warning sign. And why is
Right.
this important is because if we pick up something very early on, we can intervene very early on. And if we intervene very early on, we can actually avoid a completely full-blown episode. And many times
Yeah.
in my experience, that's been the case. So patients are very well informed about the condition. They'll contact me and say like, oh, 2, 3 days, I've noticed this is happening. We can adjust medication or look at what additional support might be needed. And we can completely avert a full-blown episode.
So there's a patient responsibility to communicate and access the resources that are at hand. And that treatment plan often involves even a GP, your psychiatrist, a psychologist. I've even heard part of the treatment plans for people that are living with chronic disorder to have an OT to help them with day-to-day lifestyle changes. But I want to come back to the medication because I think this is always a favorite
Mm,
when we're working with bipolar. So people reach like, okay, first of all, they don't want to take medication. But if you are on medication, can you just share the extreme importance of maintaining your medication? Because so many patients seem to say, I'm feeling better, and then they stop.
yeah.
And that's a problem.
Absolutely, absolutely. So you have to understand that medication is the cornerstone of the treatment plan. So yes, there are many components of the treatment plan, but it is one of the most important aspects of treatment. Um, and you're absolutely right. So adherence to treatment is crucial, and there's many reasons for this. The medication that individuals use, you need to think about it. Let's use the example of maybe somebody's got diabetes, right? So if somebody's got diabetes, they've got problems with their blood sugar levels. They can have all the therapy they like in the world. It's not going to change their blood sugar levels. They're going to need some medication. Right? Not to say that the lifestyle changes and other therapy is not helpful, but they're also going to need medication. So that medication is going to help to stabilize their blood sugar levels. When they
Mm,
stop their medication, their blood sugar levels will go up. So
correct.
I often use this as an analogy. Say, okay, so do I tell the person who's using maybe insulin or medication for that, you're addicted to your insulin. See, you can't manage without your insulin, right?
Mm,
No, we don't say that. We recognize that for whatever reason, this person has a medical condition. They need that medication to assist their body, to help their body to regulate itself. In exactly the same way, when we have bipolar affective disorder, for whatever reason, the body and the brain is not able to completely regulate the emotions. It needs some additional help. And that is the role of medication. So it helps to stabilize the individual. And there's various types of meds, and if you want, we can go into some of the details about that. But essentially, the medication is there to stabilize the moods. It
right.
minimizes relapses. And why is that important? Because having fewer relapses, being stable means you can be productive, you can have a normal lifestyle, you can maintain relationships, you can continue working. The converse is also true. So many people, as you mentioned, they're feeling fantastic, they're feeling fine. Then they stop the medication. What they don't actually realize, and often this is where the education comes in, that the reason you're doing very well is because the medication's working. That's
Correct.
not well.
Yes. Yes.
Right. So often it's a challenge, and I guess it's also links into something mentioned earlier that, when you're talking to somebody in their 20s to say that, you have to take this medication and you're probably going to have to take it very, very, very long time, it becomes a challenge because like, how do you convince a young person to take medication for a very long time?
Mm,
And particularly when they perceive that they're feeling well.
mm,
So when people stop the medication, this is the downside. You have a significant increase in relapses.
yeah.
The more relapses you have, the worse the condition becomes, right? So
Mm,
each episode then becomes more severe, and the frequency of the relapses also increases.
mm,
More
mm,
importantly, the more relapses you have, the more it has a detrimental effect on your functioning. So, for example, it then has a negative effect on your ability to maybe maintain work, to maintain relationships, to get on with your daily life. More importantly, we know there's also cognitive changes that happen over time. So you need to almost think about each episode like a toxic episode to your brain. So I use the analogy of like someone who's had a heart attack. Someone who's
mm,
had one heart attack, okay, they can go see the cardiologist, they might recover, and the heart's kind of okay. They've had 5 heart attacks. That heart is never going to be the same after 5 heart attacks, even if there's been a period of recovery. So in a very similar way, each episode that you have is kind of the equivalent of that to your brain. It's an assault to your brain. So the more episodes you have over a period of time, there's going to be an incremental deficit that happens over time. So not only is there a cognitive problem, but also, in terms of your physical health, well-being is also affected. So essentially over a long period of time, the more episodes you have, the worse the outcome, the worse your prognosis. And I think this is the tricky bit, because trying to convince somebody in the 20s that if they don't follow the treatment plan, by the time they're 40s, 50s, 60s, things are going to not look that great.
Mm.
But this is why the education is so important.
Yeah. And this is something we often hear with callers phoning in. Stop their medication. The medicine is still sitting in the kitchen cupboard or the bathroom cabinet. And 2 years later, like, don't worry, I'll go back on my meds. You can't just revert back to the same dosage and medication that you may have stopped 18 months ago.
Absolutely. And certain meds we have to actually build up over time. And so, for example, some of the medication, like one of the common mood stabilizers, something called lithium, right? That's
Right.
often widely prescribed. So lithium, it can potentially be problematic because you can't just start taking lithium without having blood monitoring, right?
Correct.
Because lithium only works within a certain range. And if you take too much lithium, it can actually be toxic to your body. So yes, we
Mm,
do use it, but we use it in a particular way with proper monitoring. So again,
mm,
this is something that you can't just willy-nilly stop and start.
yeah.
Similarly, there's another medication commonly used called lamotrigine. Uh, Common sort of trade name is called Epitec. So lamotrigine, about 1 in 10 individuals will have an allergic reaction. And this is worse if you use a higher dose. So again, this is a medication that we would build up very gradually, increasing it every 2 weeks. So if somebody, for example, we would start with 25 milligrams. Yes, they might eventually get to maybe 100 or 200 milligrams. Then they stop the medication for a few months, perhaps, as you've said. So then you decide, you know what, I'm going to go back to 200 milligrams because that's what I was on last time. And then they're more likely to actually trigger an allergic reaction. So you're
Mm,
absolutely right. You can't just jump in and decide, okay, I'll take, the dose that I remember having had last time. And also you can have more adverse side effects. And also things might have also changed by the time you've now relapsed on this occasion or you stop your meds. So maybe what might have worked before may need to change. So that's why the consultation is important, right? Or you might have had problems with it, and often that's also one of the reasons people stop medication is because they realize they're having side effects, but they don't necessarily inform the treatment doctor that I'm having these side effects. The first step is, oh, I'll just stop the medication because it's causing me a problem. Um, but in many instances, side effects can be managed, or there's strategies that we can employ to minimize side effects. So that's not necessarily always a reason to stop medication.
yeah. I remember listening to one psychiatrist, and he said, doesn't matter what medication it is, even if we're talking specifically about psychiatric medication, there's always side effects of medication, and you need to balance out what you would rather need to address and stabilize. And it's a fair point, even in the winter and the flu season, there's side effects from antibiotics just taken to get over bronchitis. So we need to balance that out. And I think the message is really loud and clear to everybody listening today that medication is crucial to the stability of bipolar disorder, and any changes that need to be done, they need to be done in consultation with your primary care physician, which should be a psychiatrist. And again, people need to be reviewed because we grow, our bodies change, our brains are developing and changing. So what sort of time period should people be looking at to see their psychiatrist on a regular basis? On a monthly basis, every quarter?
So I think it depends where you are in your treatment phase. So early on, for example, somebody who might have just been diagnosed and just starting treatment, you might need to be seen every few weeks, particularly if, for example, you're titrating up doses of medication. So it might be that maybe you need to be reviewed after 2 or 3 weeks of initiating medication, then maybe 3 or 4 weeks thereafter, until things start to stabilize.
Mm,
Sometimes the individual might even need to be admitted to hospital. So depending on how severe the episode is, They might actually then be in hospital, and obviously if they're in hospital, they're going to be seen a lot more frequently, perhaps daily or every second day by their doctor for more intensive intervention. So
Right.
that's sort of the initial treatment phase, I would say, that the intensity is probably a lot higher. Once somebody's starting to stabilize and now, for example, the symptoms are abating, they're starting to feel better, and we sort of found a combination of medication that's working with them, then the frequency of follow-up visits would be less. So it might drop to maybe once a month, then perhaps once every second or third month, maybe once a quarter. It also depends on what meds are being used. So, for example, I mentioned lithium previously. So,
Yeah.
ideally, with lithium, we want to have regular blood tests to check the lithium level. And that might be once a quarter that the individual might go for a lithium blood test. Once every 6 months, they might have additional blood tests to check on other blood parameters that they're okay. So there is sort of that ongoing monitoring. And that monitoring doesn't always have to just be with a psychiatrist. There are many good GPs. So often again, it's about this collaborative working with other professionals. So a psychiatrist, for example, might initiate the treatment, but once it's stabilized, we might be able to hand over to a GP and say, okay, now the individual is stabilized. Can you just continue monitoring them? And I think another important aspect, not just monitoring the medication part, it's also about monitoring the physical health aspects. So we know
Mm.
so yes, there are side effects, but we also know that many individuals who have mental health problems have physical health problems. So there's a close relationship between mental health and physical health. And we know that particularly there's higher rates of what we call metabolic conditions, diabetes, hypertension, cardiovascular disease, amongst individuals who have mental health problems. So again, a GP is well placed to monitor these things. So monitoring weight, monitoring blood pressure, monitoring sugar levels over time, monitoring cholesterol over time. So working with a GP can be very helpful over time. So as part of the longer term plan, you can have both monitoring from the GP and then maybe less frequently you would see the psychiatrist if you're stable.
Which is so incredibly helpful because, especially here in South Africa, where our resources are stretched to capacity, it helps to understand that. And the way you've explained it makes it a lot more accessible to so many more patients. And then I would say, whilst not part of today's particular discussion, but having the onboarding of a trusted therapist, whether it were to be a psychologist or a registered counselor, to help you establish those lifestyle routines and support you before the crisis is also so incredibly important.
Absolutely. And very often, individuals are seeing a psychologist and the psychiatrist for that reason. And often psychologists, because we have a lot more psychologists, they have more accessibility in terms of being able to spend more intensive time with individuals, being able to sort of do the therapy. And I think this is also important. So although I've sort of emphasized medication as being a cornerstone, but psychological therapy is equally important. So, and psychological therapy can take many different forms. So
Yeah.
one of the key ones is what we call cognitive behavior therapy. I'm sure you've probably had previous programs about cognitive behavior therapy. Another one we've mentioned earlier was psychoeducation, understanding about your condition for you and your
Mm,
family.
mm.
Family therapy, couple therapy, and also things like stress management, since we mentioned earlier that often stress is a trigger. So looking at ways of managing stress. And the other key one is mindfulness. So mindfulness is a very useful technique. So
Yeah,
these are often psychological therapies that are very helpful. They can also be very cost effective because psychological therapy doesn't always have to be individual. It can be done online, also can be done in a group format. So often it's
yeah,
more accessible and more cost effective over a
exactly.
period of time. And coupled with that is what you've mentioned earlier about lifestyle interventions. And probably this is probably one of the most crucial things that I think often overlooked is the lifestyle interventions. So there are two key things I think when I think about sort of non-medication sort of treatments, so that
Yeah.
putting aside the sort of psychological therapy. And these are often simple things. So the one is routine and one is sleep. So routine, very powerful, easy to do, and what's most important, completely free, free of
It
charge.
is. It is.
Right,
It
it
is.
is. Okay. So why is routine important? So when you think about someone who's got bipolar, what we're wanting to do is to regulate the sleep-wake cycle, right? So they need to have a regular schedule. And this is where routine is important. So it kind of helps to regulate the body clock of yours, right? So you should aim to have a regular routine, aim to have a regular time that you wake up, a regular time that you go to sleep, regular working hours, regular meal times, regular structured activities for your day or for your weekend. And all of this then helps to stabilize your mood. Also
Mm,
important, having a schedule that helps to reduce stress. So what I mean by schedule, like it's like planning ahead, having a
mm,
diary, having a timetable, and often I find this that patients procrastinate, so they have certain tasks that they need to do, particularly students, and they leave it to the last end. So what they're going to do, they're going to cram, or they've got an assignment to do, and they're going to stay up a few nights now because they're needing to complete the task. And
mm,
when they have disruption of that sleep-wake cycle, then that triggers a relapse. So just
mm,
having a schedule, understanding, what I have to do, break up my task in a period of time. This is all part of having a routine. And this is where OTs are particularly useful, I find. So very often occupational therapists are fantastically placed at helping individuals do this type of activity. So it sounds very simplistic, but it's incredibly powerful. And also, as I said, it's often overlooked. And many patients don't understand that just simple interventions like having a diary, having a routine, breaking up tasks, having a routine can help you. And one of the benefits of sometimes patients coming into the hospital is that they have a ready-made routine. So they come into a hospital setting as an inpatient, and then there's a routine. They have a structure because you have a meal time at a particular time. You have to have breakfast at that time. You have to do an activity at that time. You have to go to a group at that time. So very quickly they get into a routine. And then
right,
once they're into that routine, it's much easier to maintain that routine once they're discharged. Right. So
right.
actually one of the probably the key benefits of an admission is something as simple as just trying to instill a routine in that individual. And then helping them to then maintain that routine helps with, for example, being consistent with your sleeping schedule, being
Okay.
consistent with your medication schedule, because now you have routine. So now your compliance is better. Right. So
Yes.
so these simple interventions are very helpful. And then alongside that, very, very importantly, is regular exercise. So often we don't emphasize exercise enough, but there's a lot of literature out there that attests to the benefits of exercise, both for
Mm,
depression, stress management, anxiety, and a whole host of things, including all the lifestyle factors. So I definitely highlight, that exercise is very important. So you need to almost think of exercise like medication. So just like you're going to be taking your medication every day, you need to have an exercise routine that you can do every day or every second day, and that needs to be part of your normal routine. So it's not like, oh, I don't feel motivated today to do my exercise. Well, you're going to take your medication even if you're not motivated. You need to do your exercise even if you're not motivated. And
so,
that
so,
helps
yeah.
that helps with your structure, routine, and also with your mental health.
Yeah. And that's where the static can also be incredibly helpful with providing the space for static support groups. So people living with the disorder can come together either face to face or they can connect online and almost like buddy up. You find somebody who says, I've done that before. Don't do that again because it's going to put you back a whole lot of weeks. And so the power of support groups in managing bipolar disorder, I think, is incredible, and should be added to kind of like that holistic treatment plan that you've so perfectly outlined, during today's discussion. Dr. Hussein, you have covered so many aspects. I know we're going to start to wrap up, but I wanted to say if you had a short message of hope for somebody who is now being diagnosed with bipolar disorder, what would your message of hope be in that moment of receiving the message?
Okay. So first of all, it's okay to feel uncertain. It's okay to feel scared. It's okay, to have that oh my God moment. It's okay. That's normal. But key thing is remember that you're not alone. That there is help available, there is support available, as you mentioned, Sadok, and many, many other individuals who are out there. Number two, as we mentioned earlier, a diagnosis is not a life sentence. A diagnosis does not define you. Rather, it is that first step to your road to recovery, as I've mentioned earlier. And yes, there are going to be challenges. I think we have to be realistic. There are going to be challenges out there, but with time, with the right treatment, with the right support, you can definitely build a stable and meaningful life. And the reality is that in my career, I've seen many, many, many patients with bipolar over the years, and they managed to lead very fulfilling, very productive lives. So I think my final message is that, embrace your diagnosis, don't fight it. Empower yourself by learning about the condition. Create that network of support around you, and including, people like Setup. So when you talk about network, includes that peer support. And importantly, work with your mental health team. And if you do all of those things, you can achieve great things. That's my
Thank you
final.
so much for your time. Those are wonderful words of hope, message of inspiration. You don't need to do this alone, and let us all help you. To everybody today, thank you so much for joining us online. Please, if you have questions, post them in the chat group. Make a phone call to SADAG. The counselors are on standby. We're there to help you. We're there to guide you through any country, province in the country of South Africa, whether you're a patient, undiagnosed, diagnosed, or a family member living with somebody with the bipolar disorder. Don't do this alone. We're there to help you. Dr. Hussein, thank you so much for your time today. We appreciate it. And it's a wrap. Thank you, everybody. Bye bye.
Thank you very much.